I actually didn't preview that that intro. It was one of our communications agencies, and I'm like, that was a really complicated intro. I'm not exactly sure what I'm supposed to be talking about. Anyway, happy to be here, and thank you very much for the invitation. My name is Mark Allen. I'm the Director of Strategic Partnerships for Merck For Mothers. Merck For Mothers is Merck's signature CSR initiative. It's a 10-year, $500 million commitment focused squarely on maternal health globally. And I wanted to sort of talk about, why maternal health, and also how Merck For Mothers, I think, is uniquely trying to solve for the issues around maternal health. But before sort of talking about and speaking in statistics around the issue, we actually just recently produced a film that I think actually speaks at the heart of the issue and the gravity of why this is such an important initiative and why Ken Frazier and Merck had made such a large commitment to this particular issue. So if you could just cue the video. But what that film represents, and I encourage you guys to go onto our website and look at the film, it really sort of provides three different narratives of women in different parts of the world in labor and childbirth. And the inspiration for that film, if you looked out into pregnancy, women are often pregnant in golden in fields of like sunflowers, or looking always very happy. And the reality is pregnancy is very tough. And in some parts of the world, it actually is a light and threatening process. And so part of that film talks about that narrative, but also really talks about the importance of partnership and the fact that it's really critical to have a lot of different types of partnerships in different sectors pushing together to really address maternal health globally. So the problem statement, very simply, is 800 women die per day due to complications in childbirth. And the reality and the real hardship of that is 99% of those deaths are actually preventable. And that was sort of the rallying cry in terms of why Merck For Mothers wanted to make the investment. It's not just about saving the woman, but we all know, if you can just sort of reflect, that with your mom, think for a second if you didn't have your mother as part of your life and what your journey and your path would look like today. It would be very different. And in some of the countries that we're working in, when a woman dies of complications due to birth, if that child survives, they have a 10-time higher risk of dying before the age of 2. The children that survive have a 10 times more likelihood of not completing their education, contracting other health issues, and also dying prematurely. So we all know that the woman and the mom is really the nucleus, not only of the family, but of the community, and particularly in some of the communities that we work in. And so saving that woman has a tremendous amount of a ripple effect. So it's really this problem statement that inspired Ken Frazier, our CEO, about 6 years ago during the UN General Assembly, where he made a very bold announcement with the Merck For Mothers initiative. And it wasn't just about $500 million over 10 years. It was also about bringing the best of private sector, the business and scientific expertise of Merck, to the problem of maternal health. And if you think about the importance of the SDGs and the new framework, it's really critical to have private sector at the table. And that's been one of our big mantras going into this initiative, focusing on maternal health, but also recognizing that the private sector has to be at the table. It's this multi-sectoral collaboration. And, I've been at UNGA this past week in a lot of different meetings, and I hear a lot of the sort of development buzzword being goes around public-private partnerships and multi-sectoral approaches and innovation. And what I'm hoping to do today is actually sort of underscore that rhetoric with very specific examples of living that mantra around the best what private sector can bring to the table in the vein of maternal health. And I'm going to give you 3 different examples. The first is the informed push model. This is actually a project that we did in Senegal. About 4 years ago, when we were doing a landscape of where Merck For Mothers could really make an impact, the Bill and Melinda Gates Foundation knocked on our door and said, we have an interesting problem to solve in Senegal. 4 years ago, when women were looking for family planning commodities and contraception, and they were going to the local health clinics, 8 out of 10 times that they would go to that clinic, there wouldn't be the product in stock. They had an 80% stock out rate for family planning. So we looked at the problem and we involved Merck experts in terms of supply chain to understand what was the issue. Well, the ironic thing is that most of the countries that we're working in have publicly driven supply chains. But if you look at any OECD country, they've all outsourced their supply chains to third-party logistics providers. They're much more well-equipped to be able to handle and to be able to align the incentives to deliver the services that they need. So we propose that the Senegalese government outsource the supply chain to a third-party logistics provider in a pilot basis. We expanded that pilot district by district until we scaled it nationally. And we've taken the stock-out rates from 80% down to 2%. And we've been able to do that over 48 months consecutively. So it was a private sector solution that was addressing a very public health issue. We also, through every sort of twist and turn, had barriers in terms of the government's resistance to outsource their public, heavily run civil society supply chain. It's going to cost too much. How do I displace civil servants and create smaller jobs into the private sector? So we had to bring in a lot of Merck experts in terms of doing a lot of costing, a lot of feasibility, and really demonstrate that if they deliver and this is a more cost efficient and provides higher performance in terms of supply chain. The next example actually really leans into Merck's DNA in terms of medicine and science. Heat-stable carbetocin. For those of you that are not familiar in terms of maternal health, the leading cause of maternal health is bleeding. It's postpartum hemorrhage. And the current standard in terms of prevention of postpartum hemorrhage is a drug called oxytocin. The problem with oxytocin is it degrades if it's exposed to heat. It requires a cold chain storage. If you can imagine the countries that we work in the health systems, cold chain storage doesn't exist or it's very unreliable. We did a landscape assessment and discovered this drug called carbetocin. It's a drug that's owned by another competitor, another pharmaceutical company called Ferring. So imagine two private sector companies actually in partnership. We were actually able to license this drug and working with the WHO have done a clinical trial in over 11 countries with 30,000 women to demonstrate that this drug is the equal efficacy of oxytocin. So that's not enough to demonstrate that it's on par and it's heat stable. Also, we had to bring the cost down because if you're talking about behavior change, particularly in ministries that have very constrained resources, they're always going to defer to the lower cost product. So we used Merck experts to re-engineer their cost of goods and got it down to a cost parity. The clinical trial should be done by the end or at the end of this year and the results in the early part of next year. And we're very confident that they're going to demonstrate the objective of the study, which is to demonstrate efficacy with oxytocin. We then will really engage Merck's experts in terms of how do you bring this product to market in terms of the behavior change and the advocacy to change the provider's behavior. It's very similar to what we do in the commercial side of the business in terms of bringing new vaccines and medicines to the market. And the last example that I'll leave you with really leans in on the mantra that Ken laid out for Merck For Mothers. We want to be able to take risk. There's a lot of bilateral donors and other multilateral donors who can't necessarily do that. The U.S. aid has to be somewhat conservative because it's U.S. taxpayer money. So we are in a unique position to be able to innovate and be able to take risk. We use the mantra of failing fast and failing early and being able to course correct with some of our products. In our digital portfolio, we've really sort of embraced this mantra, but really kind of approached the partnerships with some of our local partners differently. For example, a project that we're doing in Kenya is called Nivi. It's a family planning product. It's an IVR platform where women of reproductive age, primarily adolescents, can access this service for free. They can, through a series of questions that are evidence-based, answer questions around their family planning choices. And at the end of that discussion, or end of that call, it actually provides method mix based on the responses. It then connects them to a facility where they actually have that particular product. And then also, based on some of the responses, if they qualify, connects them with a transportation voucher to get them to that facility. And to close out the loop, giving them a stronger sense of agency in terms of the quality of services that they're receiving, allows them to rate the feedback for that particular service. Now, it's interesting in terms of an innovation, but I think it's even more interesting in terms of how we're partnering. One example is when we did the pilot, it was with a large international NGO called Population Council. They're not a technology firm. They're a firm that is entrenched in the field and really understands family planning contextually, but is not in the business of building apps or technology. So when we did the pilot with Population Council, we kind of had to have a hard discussion with Population Council. Merck For Mothers is a 10-year initiative, and we're not in the business to invest in these programs for perpetuity. Population Council is not equipped to develop technology and maintain technology applications. So we spun it out into a social enterprise, and in the next phase in terms of the pilot, very much in terms of building the technology and scaling the technology, is also a business case problem that they're also trying to solve, which is how do they make this enterprise bankable and investable? How can they attract venture capital and other financing outside of the donor world? We even created a contract where if they raise a certain amount of money, Merck For Mothers actually gets a buyout of that equity, and then we can reinvest it in other technology, other solutions, or non-commercial programs that we're doing globally. So those are just three very specific examples where I think private sector really can bring a unique lens to these problems. We can't do it alone. We have over 90 partners that we work with. And often we're working with NGOs or the civil sector society that's bridging that gap between the private sector and also the governments in the countries that we're working in. The reality is that the private sector has to have a strong voice. The SDG platform has very ambitious goals, and it's a very holistic approach, thus 17 goals. And in the 17th goal is actually recognized in terms of the importance of partnership. It's not easy, but I would encourage those that are here, that are particularly in the NGO sector, to look at private sector and make sure that you're really gaining their comparative advantage. And that's their ability to look at things differently, to be able to not only just use their financing and their funding, but lean in on their expertise, like we do with our partners in the ground. And I think you'll be able to actually extract more value out of those partnerships than just thinking of private sector as as either more philanthropic or just writing big checks. So I think collectively, if we approach partnership in a new model, I think we can all help achieve our goal and Merck For Mothers' mission, which is making sure that women don't have to fear for their lives while giving life in certain parts of the world. Thanks.